By now, you've probably heard of COVID-19, or coronavirus disease discovered in 2019, which is responsible for a global pandemic. Thus far, the main country affected has been China, but it spread to a number of other countries around the world to a varying degree. The virus was initially referred to as the 2019 nCoV, or the 2019 novel coronavirus, and was informally called the Wuhan coronavirus. The World Health Organization named the disease COVID-19 because it doesn't refer to a geographical location, an animal, a person, or a group of people, all of which can lead to stigma. They also wanted to make it pronounceable and related to the disease, which is not an easy task. The virus was officially named SARS-CoV-2, or Severe Acute Respiratory Syndrome Coronavirus 2, because it's genetically very similar to the SARS coronavirus, which was responsible for, well, the Severe Acute Respiratory Syndrome, or SARS outbreak in 2002. So, SARS-CoV-2 causes COVID-19. Now, coronaviruses that circulate among humans are typically benign, and they cause about a quarter of all common cold illnesses. But occasionally, coronaviruses that circulate in an animal reservoir mutate just enough to where they're able to start infecting and causing disease in humans, if they're given an opportunity. In 2002, SARS was a coronavirus that hopped over from bats to civets, which is a cat-like mammal, and then over to humans. And in 2012, there was MERS, which was a coronavirus that hopped over from bats to camels a few decades ago, and then circulated among camels for quite some time before eventually infecting humans. COVID-19 most likely also started with bats, but this time the intermediate host was probably a pangolin, an animal that looks like a cross between an anteater and an armadillo. That's based on the fact that scientists identified a coronavirus in pangolins that's a 96% genetic match to SARS-CoV-2. Sadly, pangolins are heavily trafficked around the planet, largely because people believe that their scales have healing properties. And because they're moved around the world rather than just left in the wild, there are ample opportunities for a coronavirus to go from a pangolin to a human. As of February 11, 2020, there have been 43,103 cases of COVID-19 and 1,018 deaths, with a fatality rate of 2.4%, according to the World Health Organization. The vast majority of cases and deaths have occurred in China. For a little perspective, the 2002 SARS outbreak resulted in 8,098 cases and 774 deaths, so the fatality rate was around 9.6%. And the 2012 MERS outbreak resulted in 2,494 cases and 858 deaths, bringing the fatality rate to 34%. Finally, for the 2014 Ebola outbreak, which was granted not due to a coronavirus, there were 28,639 cases and 11,316 deaths. The fatality rate was a whopping 40%. At a microscopic level, coronaviruses are single-strand positive-sense RNA viruses with protein spikes on their surface that look a little bit like a crown under a microscope. In fact, corona is Latin for crown. Besides just looking majestic, these spikes allow the virus to invade cells lining the respiratory tract and lungs. After binding, the coronavirus enters and takes over the cellular machinery to make more and more copies of itself, so it can spread to the surrounding cells and get into the mucus. Sometimes the infection is mild, and some people don't develop any symptoms at all. For others, they can develop symptoms that range from pretty mild, like fever, cough, and shortness of breath, all the way to serious problems like pneumonia. Severe lung damage can cause acute respiratory distress syndrome, or ARDS, which occurs when the lung inflammation is so severe that fluid builds up around and within the lungs. The severe infection can cause septic shock, which happens when the blood pressure falls dramatically, and the body's organs are starved for oxygen. ARDS and shock are the main cause of death for people with the infection, and this is more likely to occur in those over the age of 60, smokers, and people with previous medical conditions like hypertension. In addition to causing disease, coronaviruses can spread quickly. Usually the virus spreads when people cough or sneeze, and tiny droplets containing the virus are released. These droplets can land on another person's mouth, nose, or eyes, and that allows the virus to enter a new person. The virus can also be found in a person's stool, and in rare situations, coronavirus has been transmitted from one apartment to another within a residential building. This was also seen in the 2002 SARS epidemic. At that time, faulty plumbing allowed virus-containing fecal matter originating from one person's apartment to drift from drainage pipes back into fixtures like sinks and toilets within other apartments in the same building. Not only did this create a terrible smell, but it also allowed the virus-containing droplets to deposit on bathroom surfaces, ultimately causing people in those apartments to get ill. Something similar may have happened with COVID-19, and this is being actively investigated. Once a person is infected, symptoms develop an average of 5 days later. This is called the incubation period. However, the incubation period varies from person to person, and in some studies, it's lasted as long as 24 days. Now, there's debate about whether or not asymptomatic people can spread the disease, because these people typically have low levels of circulating virus. But even if they do, asymptomatic transmission likely plays a minor role in the overall epidemic. Viruses are given a reproductive number, or R0, based on how quickly they spread, and person-to-person transmission has been confirmed both in and outside of China. An R0 of 1 means that an infected person passes it on to one new person. An R0 of 2 means that one person spreads it to 2 new people, and so forth. If the R0 is below 1, the infection peters out. If it's 1, it stays steady. And if it's above 1, then it continues to spread. The current estimate of the SARS-CoV-2 R0 is between 2 and 2.5. Of course, that's an average, with some spreading the disease less, and others, called super spreaders, spreading the disease at a much, much higher rate. The exact cause of these super spreaders is unclear. Perhaps they're just in contact with more folks. Perhaps their bodies naturally shed more virus. Or perhaps there's some other reason altogether. To confirm the diagnosis, there should be a real-time polymerase chain reaction, or RT-PCR test, which is a quick test used in many labs and hospitals that can detect very small amounts of viral RNA. Treatment is focused on supportive care, providing fluids, oxygen, and ventilatory support for really ill people. There's also some early data showing that 3 medications are highly effective against SARS-CoV-2 in the laboratory setting. These medications are chloroquine, an anti-malarial drug, ritonavir, an anti-HIV medication, and remdesivir, an antiviral drug previously used against Ebola. Remdesivir was given to the first US patient with COVID-19 on day 11 of his illness as he was clinically worsening, and he began to improve the very next day. Large-scale clinical trials using remdesivir are already underway in China. Unfortunately, there's no vaccine currently available to protect against COVID-19. At best, it looks like a vaccine will be many months away. So, for now, the goal is to avoid human-to-human transmission, starting with isolating people with COVID-19. Coronaviruses don't usually spread over long distances in the air, but they can travel roughly 3 feet, or 1 meter, from one person to another on tiny droplets of saliva, which are produced when someone's coughing or sneezing. In addition, some strains of coronavirus can survive on surfaces for over a day. With that in mind, if you're a healthy person living in a non-outbreak area, the recommendation is to avoid travel to disease outbreak areas, generally stay away from crowded places, and stay at least 6 feet or 2 meters away from anyone with symptoms. Wearing a surgical mask is not recommended because the general risk of getting COVID-19 in these settings is so low. As always, careful hand washing is the key, and it should be done with soap or alcohol-based hand sanitizers, and scrubbing. Also, avoid touching your eyes, nose, and mouth. This area is known as your T-zone, and it's a common entry point for viruses into the body. For healthcare workers who are around people with COVID-19, the recommendation is to apply droplet and contact precautions. That includes wearing personal protective equipment like a clean, dry surgical mask, gloves, long-sleeved gowns, and eye protection like goggles or a face shield. When performing a procedure that generates aerosol, like tracheal intubation, bronchoscopy, CPR, or non-invasive ventilation, it's important to wear an N95 respirator. This prevents 95% of the small particles, like respiratory droplets, from passing through. Alright, as a quick recap. The SARS-CoV-2 virus causes a respiratory disease called COVID-19. The virus probably originated from bats, and then went to pangolins as an intermediate host, and finally to humans. The virus travels in respiratory droplets and enters the body via the mouth, nose, or eyes. Once inside the body, it replicates in the respiratory system, causing symptoms like fever, cough, and shortness of breath. Some people might develop more dangerous complications like pneumonia, ARDS, and shock. Treatments are focused on supportive care, but certain medications like remdesivir are currently in clinical trials. In the meantime, the best strategy is prevention. This includes careful hand washing, avoiding traveling to disease outbreak areas and crowded places when possible, avoid touching your T-zone, and, if you're a healthcare worker, using personal protective equipment.